Today I wanted to speak a little bit about constipation and answer some of the questions I commonly receive from my patients regarding constipation and bowel hygiene. Probably the most common question I get is, how often should I have bowel movements and what is considered normal? I would define the typical frequency of bowel habits to be anywhere from 3 times a day to 3 times a week. Equally as important, though, is the consistency of the stool. If it requires significant effort, and if you feel empty after you have used the restroom. Now that we have established normal, how would I define constipation? Constipation can be defined in several ways. Hard stools, straining, infrequency of bowel habits, or a sense of incomplete evacuation where you don't quite feel empty can all be signs of constipation. Prolonged toilet time may be a sign of constipation, but can sometimes reflect difficulty with bowel habits rather than a stool issue, which is a slightly different issue and may require a bit of a different evaluation. What are some symptoms of constipation besides just the bowel habit changes? Aside from what we just mentioned, you may experience bloating, abdominal pain, cramping, rectal pain, and sometimes nausea or vomiting. These may all be symptoms related to difficulty with stool passage and distension of the colon. Why might you have constipation? What may be causing it? This is a tricky question, and part of a consultation for constipation is defining whether this is constipation that started suddenly, gradually, or has been chronic over a longer period of time. Gradual or chronic constipation may be related to a dietary lack of fiber or dehydration, metabolic changes such as low thyroid levels, motility or slow transit of the gut, side effects to other medications or supplements, or many other reasons. Sudden onset constipation often warrants a more aggressive evaluation to make sure there are no causes of impingement or blockages of the colon underlying the constipation. How do we evaluate constipation? First and foremost, with a careful history taking to identify potential issues related to medications, supplements, and dietary factors. Blood testing may be ordered to evaluate for any anemia or low blood counts, which would warrant further follow-up testing, and thyroid hormone levels. Depending on other symptoms and how long the constipation has been occurring, you may benefit from imaging studies and colonoscopy. An interesting exam that we perform for constipation evaluations is called a SITS marker study. It is a very simple exam where you get an x-ray of your belly and swallow a capsule with several radiographic beads. You take x-rays over the next few days and we can see the pattern of travel for the beads. This often allows us to differentiate between slow transit, blockages, or anorectal disorders masquerading as constipation. What kind of treatments are there for constipation? Once an evaluation is complete and other underlying issues have been ruled out, treatment often depends on the cause. If the issues are dietary or medication related, often reversing and or supplementing will fix the constipation. Treating patients for hypothyroidism, if diagnosed, will often address the constipation as well. For persistent constipation, there are several over-the-counter and prescription strength laxatives available. While many of these medications are approved for and safe to use chronically, they are not all created equal, and I would recommend a discussion with your doctor regarding specific treatments before taking any medication long-term. In review, there are a wide range of normal bowel habits, but constipation is a very common issue. You should always make sure that you are eating enough fiber and drinking enough water. If you have sudden onset constipation or if you have persistent constipation, you should contact your gastroenterologist for a formal evaluation. For information regarding other GI conditions or to request a consultation, please check out my website at www.stuartakermanmd.com.